Hello everyone, welcome to sqadia.com. My name is Dr. Divan and the topic of the lecture today is pulmonary neoplasias. In this lecture, we're going to talk about what neoplasia means, what part of the lung is most prone of getting the neoplasia, of getting the cancer. We're going to talk about the types of cancers inside of lungs. We're going to talk about what benign tumors are present inside of lungs. We're going to talk about what malignant tumors are present inside of the lungs. We're going to talk about what extra tumors, which are not even inside the lungs, how do they migrate here and affect the lungs in return. So let's start with the most benign tumor of the lungs that we have, pulmonary hamartoma. We're going to talk about its occurrence. We're going to talk about which age gap is going to get affected with pulmonary hamartoma. We're going to talk about its risk factors. Then we're going to talk about what will it look like on a histopathological slide. Next on, we'll talk about carcinoma of the lung, the topic of the day. Carcinoma of the lung, we'll talk about what carcinoma of the lung actually means. Then we're going to talk about how does that pathophysiology or pathogenesis occur, in which the stages of those cells start with proliferation of basement membrane and at the end ends with dissemination of those cancer cells inside of the bloodstream and reaching to other organs. We're going to talk about how does that happen stepwise. How does a normal cell reaches up to the level of a cancer cell and disseminates inside the bloodstream. We're going to talk about the classification of the carcinoma of the lung. We're going to talk about what T and M staging actually stands for. What is actually T, and what does, when a person comes to you, how does stage helps you. We're going to talk about what kind of benefits we get out of staging. Then we're going to talk about what local effects carcinoma of the lung has on a person. Then we're going to talk about some syndromes, which are paraneoplastic syndromes, Pancoast syndromes. All of these syndromes will be discussed. We're going to talk about how and why does the lung cancer affects the person with Horner syndrome. Next on, we're going to talk about how do we treat the patient according to the staging of the disease. Then we're going to talk about histological subtypes of lung carcinoma. In this, we have like 30 to 40 slides. We'll go over all the type of lung carcinomas we have so that we might get to differentiate them on a histological slide when we are presented with them. We're going to talk about the key histological features of all of the carcinomas of the lungs and even the extra pulmonary carcinomas which reach here at some point. Next on, we have pulmonary lymphomas. We're going to talk about pulmonary lymphomas afterward, that what a pulmonary lymphoma will look like on a histopathological slide and how do they get there. Afterwards, we're going to talk about extrapulmonary tumors, that which extrapulmonary tumors like carcinoid tumors which start at some other place, which start at digestive tract or any kind of other origin will get here and cause the same kind of consequences that the lung cancer were already causing. To watch the complete video, please subscribe to sqadia.com, and for other variety of lectures, please watch sqadia.com. Thank you for watching.